Hi. My name is Febriana Hesti Lastari, midwifery student from Polteca's Ministry of Health Yogyakarta, Class C/P 071243211109. I will present about how to take care the newborn babies.
Newborn care. Newborn care begins at birth. Treatment aims to prevent complications as early as possible. Treatment is starting from the initial assessment to overall care. The most important of newborn care as follow. Baby bathing. First, bathing a baby is a way of cleaning the baby's body with water by flushing, putting him in water according to the appropriate sequences. Bathing a newborn is not an easy thing, especially for new mothers.
Stages of baby bathing. 1. Pour cold water into the bath and mix it with hot water, then measure the heat with your elbow because the elbow is the most sensitive measurement. 2. The baby is still wrapped in a towel, then take a cotton swab that has been moistened with warm water and not too wet, then wipe the baby's eyes with not too wet. 3. To clean areas that difficult to clean such as the earlobe, ear canal or nostril. Scalp care. 2nd, the most difficult job in caring for parts of the baby's body is the crust on the scalp. Because the scalp is contaminated with air and dust. Therefore, clean the crust on the baby's head using baby oil. The trick is to apply it to the part of the head where there is a crust, then massage gently for 10 minutes. Try to keep the scalp dry, because this crust will be worse when the baby sweats. Do not put a hat on the baby, unless it is absolutely necessary, for example when leaving the house, then remove the hat when at home or in a hair care. 3rd, hair care. To grow baby's hair does not always have to use shampoo, but can use hazelnut oil to stimulate its growth. If using shampoo, use it twice a week. The trick is to wet baby's hair using a fine spray or use a cup and then add a drop or two of shampoo. Then rub it on the head gently until it lathers. The shampoo get into his eyes, then clean it thoroughly using a soft spray. Eye care. 4th, there is a source of tears in infants above the inner eye. Every 3 seconds the source of the tears will release tears, then flow it into the channel at the end of the middle of the eye which is close to the nose. When the baby is in the womb he has never cried. Therefore, the source of tears has not been able to produce, still closed. But it could also be an open channel, then closed again. When tears flooded, germs grow which become eye droppings. This incident can harm the cornea of the eye. Therefore, it is necessary to massage around the corner of the eye using fingers that do not have long nails or use a cotton bud or clean cotton that has been moistened. Massage from the corner of the eye down to the nose area for 5 to 10 times gently. Do it for 2 weeks. Umbilical cord care. Lastly, umbilical cord care. The goal is to prevent and identify bleeding or infection early. The baby's umbilical cord is generally bluish in color and is 2.5 centimeters to 5 centimeters long after being cut. The umbilical cord clamp is opened when the cord is dry. The care considered. Therefore, it is an area that is very susceptible to infection. If the umbilical cord has not been broken when exposed to water when bathed, dry it with a clean cloth or sterile gauze and do not give any liquid or medicine at the base of the umbilical. Tips and warnings in newborn care. 1. Try not to bath the baby when the baby has just finished eating or drinking milk because they may vomit the food back up. 2. Never take your hands off the baby during the bath because the baby can slip and sink even though the water is only 5 centimeters. 3. Make sure the bath water temperature is warm enough, not hot. 4. Better to use cloth diapers than disposable diapers.
Thanks for watching my video. Do not forget to like,